We are now on the record. Today date is May 3rd, 2023, and the time is 11:39 a.m. This is the video deposition of Barbara Ferrer, being taken in the matter of Alliance of Los Angeles County Parents versus County of Los Angeles, County Department of Public Health, on behalf of the plaintiff, pending in the Superior Court of the State of California for the County of Los Angeles, case number 22-STCP-02772. We are at 333 South Hope Street, 43rd floor, Los Angeles, California, 90071. My name is Kirill Davidov of Aptos Co-Reporting, located at 401 West A Street, Suite 1680, San Diego, California, 92101. Will counsel please identify yourself and state whom you represent?
Good morning. Julie Hamill, Hamill Law and Consulting, on behalf of Petitioner and Plaintiff, Alliance of Los Angeles County Parents.
Kent Ragor of Shepard Mullen, on behalf of the defendants named in this action, County of Los Angeles Department of Public Health, Dr. Muntu Davis, and Barbara Ferrer, PhD. I am here for the witness, Barbara Ferrer, PhD, today. With me, but not speaking or participating today, is County Counsel William Birney, B-I-R-N-I-E.
The court reporter today is Kathy Inland, and she may now swear in or affirm the deponent.
Okay, thank you. Ms. Ferrer, can I have you raise your right hand, please? Do you solemnly swear the testimony you're about to state in this deposition is the truth, the whole truth, and nothing but the truth? So help you God.
I do.
Thank you. Counsel, you may proceed.
Thank you. Good morning. Can you please state and spell your name for the record?
Barbara Ferrer, B-A-R-B-A-R-A-F-E-R-R-E-R.
And do you prefer to be called Miss Ferrer or Dr. Ferrer?
I don't really have a preference.
Okay. And what is your current position?
I'm the director of the LA County Department of Public Health.
How long have you held that position?
A little over 6 years.
6 years. So help me with the math. What year did you start?
I believe 2017.
Okay. Thank you. Have you ever been deposed before?
Yes.
When was the last time you were deposed?
Maybe 20 years ago.
And what was that for?
I was the director of the health department for Boston, and I think there was a labor dispute.
The city of Boston, Massachusetts?
Well, I worked for the Public Health Commission, which was quasi-city department.
So you were the director of the Public Health Commission in Boston?
Yeah.
Any other times?
I don't believe so.
So just once. Okay, so I'm going to go over some ground rules with you, but before we do that, I do want to note for the record that my client, Sarah Beth Berwick, who is a member of the Alliance of Los Angeles County Parents, is in the lobby, and Mr. Ragor is refusing to allow her to enter the room for the deposition. I'm going to give you an opportunity to allow her into the room, or if you would like to provide legal justification for excluding my client from this deposition, I'd love to hear that.
You're in a deposition with Dr. Ferrer. I'm happy to talk with you off the record rather than take your time during the deposition.
And will you allow my client, Sarah Beth Berwick, to enter the room and participate in this deposition by sitting here and observing?
Same response. I'm happy to talk with you off the record. You're here for a deposition of Dr. Ferrer. Please proceed, or we can take a break.
So I'm just getting clarification from you that you are refusing to allow my client into the room. Is that correct?
That is not correct. I have said that you're in the middle of a deposition. Dr. Ferrer is here. I'm happy to talk with you off the record.
Let's go off the record.
We're going to the record at 11:44 a.m. We're back on record at 11:52 a.m. Please continue.
Thank you. So now we've wasted about 22 minutes in this deposition. Counsel for the county is trying to force me to sign some sort of document in order to allow my client to attend the deposition. She is sitting in the lobby waiting to be let in the building, and Mr. Raygor continues to refuse. So we are going to proceed with the deposition. You're under oath. So even though this deposition is taking place in a law office, the testimony that you give today requires you to testify truthfully under penalty of perjury as if you were testifying in a court of law. Do you understand?
Yes.
I will try to make my questions as clear as possible, but if for any reason you don't understand a question, please ask me to clarify or rephrase or repeat it, and I will do so. If you answer a question, the assumption will be, and the record will reflect, that you understood the question. Does that make sense?
Yep.
And please don't guess. I'm entitled to your best estimates, but I don't want you to guess or speculate. For example, if I were to ask you to estimate the length of this room, you could do that because you're sitting and you can see the things in the room. If I were to ask you to estimate the size of my patio table, you would be guessing completely because you've never seen my patio. Only one of us should speak at a time in order to make things easier for our court reporter. Please use words and not gestures. If you're going to say yes or no, please use the words yes or no instead of uh-huh, or a shake of the head or a nod of the head. Ask for a break if at any time during this deposition you feel you need one. Your attorney may object to some of my questions. If that happens, please pause and wait for the objection before you answer. Unless your attorney instructs you not to answer, you are required to answer my questions. Everything we say here today will be taken down by the court reporter. After the deposition is over, the reporter will transcribe what we've said. If I ask you the same questions later at trial that I've asked you today and your answers change, I will be able to comment on those changes. And one of the reasons will be to question your truthfulness. You can expect to be asked to explain the reason for the differences in your answers. And is there any reason why you might be unable to provide your best testimony today?
No.
No. Did you review any documents in preparation for your deposition today?
No.
None at all.
Just a minute. That was another question. Asked and answered.
I'm sorry, I can't hear you.
Oh, asked and answered. That was another question I said, and then I said asked and answered.
So
Julie, here are the documents.
And for the record, counsel for the county has just handed me a thumb drive. And I will take a look at these documents at our first break. Thank you very much. So you personally did not review any documents in preparation for this deposition?
Asked and answered. Go. If I don't instruct you not to answer, as Ms. Hamill said, you can go ahead and answer.
No.
No. Did you search for any documents?
No.
You did not.
Asked and answered.
Did you have anyone in your office conduct a search of documents for you?
I'm not really sure what that question would mean. In my department or in my office? The
Well,
department has 6,000 people in it, so I think if you could just clarify.
Sure. So I am going to share a document that we'll mark as Exhibit 1, the Alliance of Los Angeles County Parents Notice of Taking Deposition of Barbara Ferrer and Demand to Produce Documents at Deposition. I'll hand that to your counsel.
In the future, could you help? Thanks.
The court reporter is going to hand you that one.
Just one moment. Very good, Dr. Ferrer.
Have you seen this document before?
I have not.
You have not.
Asked and answered.
I'm going to direct your attention to the bottom of page 1. number 1. And this says any and all documents, and then there's a definition of documents, reflecting any communications between you and Brett Morrow regarding County of Los Angeles County Department of Public Health's social media posts, including but not limited to any emails, text messages, or any written correspondence. So I assume you have not looked for any responsive documents.
Calls for speculation as to what you assume.
You may answer the question.
I didn't respond to this. I didn't see this until right now. I'm assuming that if you have documents, it's other people have gone in and looked at any of our correspondence and produced documents for you. But I didn't produce the documents myself.
And you've never seen...
And I didn't look at any of the documents.
Okay. And you've never
So-
seen this document, Exhibit 1?
And I've never seen this document until you're sharing it with me now.
Asked and answered.
Do you have any idea who provided the documents that were handed to me this morning?
I do not.
Number 2, any and all documents reflecting the identification of all social media accounts used by Department of Public Health. I assume you haven't seen that before.
I
Calls
have
for
not.
speculation as to what you assume.
You may answer.
I have not seen any documents.
All right, in the interest of time, I'm not going to read all of these, but for the record, there are 23 demands to produce documents at deposition, and you have not reviewed these demands, nor have you produced any responsive documents.
I have not.
Thank you.
I have on the witness's behalf. They're in that thumb drive.
I'd like to mark as Exhibit 2, Defendant Barbara Ferrer, PhD's responses to document demands contained in Plaintiff's April 13th, 2023 deposition notice. Have you seen this document before?
One moment, please.
I have not.
I'll direct your attention to page 4 of what's been marked as Exhibit 2, lines 20 through 22. These are objections lodged by your counsel, and it says, reflecting written communications between defendant and Mr. Morrow since July 26, 2022, about closing public commentary on the County of Los Angeles Department of Public Health's public Twitter, Facebook, and Instagram posts. This is actually not what I requested. The request has been rephrased by counsel. Will counsel produce the documents that were demanded?
We can conduct our meet and confer, as I said, in my correspondence with you after the deposition of Dr. Ferrer.
And on page 5,
Can you read back the question?
Will counsel produce the documents that were demanded?
After serving these responses and then before producing the documents you have in the thumb drive, we determined there are no such non-privileged documents.
there are no such non-privileged documents
That's what I just said, yes.
that, well,
Oh, sorry.
in my demand for production number 1, I did not limit the time, nor did I limit the subject matter to closing public commentary. So I'm going to ask again if council will produce responsive documents to my demand for production number 1.
We asserted objections. I narrowed the response to what I thought was appropriate as stated in Exhibit 2, page 4, lines 18 to 22, and we searched for and did not find any responsive documents.
And I will ask again if council will be producing documents responsive to my demand.
I've already stated all I'm going to state. If you have a desire to meet and confer on the scope of the responses, we can do that, but not during the deposition. Please send me a meet and confer letter. This is the first I'm hearing about it.
And page 5, line 22, again, council has imposed his own limitations on my demand. This is not responsive to my demand for production number 2. Will council produce documents responsive to demand for production number 2?
Same response as what I just said.
And I'll ask the witness, Ms. Ferrer, Dr. Ferrer, have you conducted a search for the documents demanded in production number 2?
I have not.
You have not. Can you do that?
Calls for speculation.
You may answer the question.
I don't search for documents.
You don't search for documents.
I don't search for documents in response to requests from council or from, freedom of information requests. I mean, that's just not something I personally do. There are other people on the team that handle those requests.
Who handle those requests?
I wouldn't know their names.
So you cannot personally conduct any searches for documents?
I don't conduct
You
those
don't.
searches.
But you could.
For documents related to requests from outside sources. I search for my own documents that I need, but there's a process that the county has set up and our department uses to respond to requests for other documents.
Can you explain that process to me?
Not really. I cannot.
So
I just know that what I know is that those requests are sent to a centralized office and reviewed and then responded to. I mean, that's the best that I can help you with, sort of how it happens. I don't have any additional information.
what is the centralized office?
A centralized location would probably be better. There's a group of folks that handle requests for information. They also do other tasks as well.
Is that within the Department of Public Health or within the overall county?
Within the Department of Public Health.
So there's a centralized office within the
I'd
Department
say a centralized unit.
a centralized unit within the Department of Public Health that conducted a search for these documents.
Objection states the witness's testimony.
That is the usual process. There could have been a different process that was followed in this case, and I wouldn't know about it.
If you wanted to, could you go to your office and search for documents that I requested in this demand for production?
I haven't read this demand for production, so I'd have to read it and then make a determination if I could do it.
Well, let's go back to demand for production number 1, which requests communications between you and Brett Morrow. Would you be able to search for documents responsive to that request?
Where is that request?
It begins on page 3 and goes to page 4 of Exhibit 2.
No, I couldn't do this.
And why not?
I wouldn't know where all these documents might be.
Would you be able to conduct a search in your email inbox?
I think I can, yes.
Have you ever conducted a search of your email inbox for any content?
Not for content, but by people.
By people. So you know how to conduct a search of your email inbox for communications with certain people?
Yes, I do.
Okay. I'm going to ask that you conduct a search of your email inbox for documents responsive to demand for production number 1. And do you have a list of all of the social media accounts maintained by the Department of Public Health?
I do not.
You do not. Are you aware of one existing?
I am not.
Do you know who might know?
I would imagine that Brett Morrow, as the director of that office, would know.
And what is the office that he's the director of?
Office of Communications and I don't know, we just call it the Office of Communications, but it has a longer title.
And is that within the Department of Public Health?
That is within the Department of Public Health.
And so he doesn't do any communications work for other departments in the county?
Objection, it's not a question. It's a statement.
If you understand, you may answer.
The county is organized in a way that all of the departments will help out with communications efforts that happen in other places. So he could, yes, be helping in other places as well.
Thank you. And going on to page 5, demand for production number 3. This says any and all documents reflecting communications between you and the LA County USC Medical Center, including but not limited to any emails, text messages, or any other written correspondence. Have you corresponded via email with the LA County USC Hospital?
Well, the LAUSC County Hospital is not an email entity, so you can communicate with people that work there, but I've never communicated with them as an entity.
That's a good clarification. So which people from LA County USC Hospital have you communicated with via email?
I could not answer that.
Have you communicated with Dr. Spellberg?
I wouldn't recollect when we communicated, but I've been there 6 years, and I would imagine at some points we've communicated.
Have you communicated with Dr. Holtum?
Not to my knowledge. But again, 6 years is a long time, so I would just say I don't know.
I'm going to ask that you go back and search your email inbox for communications between yourself and Dr. Spellberg and Dr. Holtum.
Can you spell? Holtham or Holtum?
Holtom. And on page 6, we have demand for production number 4. Any and all documents reflecting communications between you and Health Services of Los Angeles County, including but not limited to any emails, text messages, or any other written correspondence. Have you corresponded with any people from the Health Services of Los Angeles County?
Yes.
Who are your points of contact at the Health Services of Los Angeles County?
I would not be able to name them all.
With whom do you most frequently communicate there?
Dr. Christina Galley.
Anyone else?
Not frequently.
And does Dr. Christina Galley oversee your department?
She does not.
Are you lateral in terms of an org
Yes,
chart?
we are.
So you have equal...
We're both
authority.
department heads.
You're both department heads. So Dr. Christina Galley is essentially what your position is in the health services. And what's the difference?
Do you have to answer
Yes.
audibly for the court report?
Yes,
That's-
Dr. Christina Galley's department is an equivalent department to my department.
And what is the difference between Health Services of Los Angeles County and the Department of Public Health?
The Department of Health Services runs the county's hospitals, and the Department of Health Services clinics. And the Department of Public Health is responsible for the public health and well-being of the 10.3 million people who live in the county. So the Health Services Department serves mostly as a provider, and the county Department of Public Health has 50-plus programs doing a range of services and support for residents all across the county.
Is it fair to say that the Department of Public Health is more policy while Health Services is more provider?
I don't think that would be the way I'd characterize it.
Would you characterize it a different way?
I would.
How would you characterize it?
The Department of Public Health provides services and supports to families all across, to residents all across the county. We also engage in some policy work, but so does the Department of Health Services. I mean, all departments are engaging in policy work, so I don't think that's an appropriate distinction.
Thank you. Demand for production number 5 requests any and all documents reflecting communications between you and Sheila Kuhl regarding Department of Public Health social media, including but not limited to any emails, text messages, or any other written correspondence. Do you know Sheila Kuhl?
Yes, I do.
Am I pronouncing her name correctly?
Kuhl.
Kuhl. So, have you corresponded with Sheila Kuhl via email?
Yes, I have.
You have. Have you
Asked and
corresponded?
answered.
I'm sorry?
Asked and answered.
And have you corresponded with Ms. Kuhl regarding the county's social media?
I do not recall ever communicating with her about that.
Do you recall Ms. Kuhl ever having concerns about the county's social media?
I do not recall that.
I'd like for you to conduct a search of your email inbox for communications between you and Sheila Kuhl regarding Department of Public Health social media, pursuant to demand for production number 5. Demand for production number 6 on page 8 requests any and all documents reflecting communications between you and Holly Mitchell regarding Department of Public Health social media. Have you corresponded with Holly Mitchell via email?
Yes, I have.
Have you corresponded with Holly Mitchell via email about the department's social media?
Not that I recall.
Okay, and I'll ask again that you conduct a search of your email inbox for communications between you and Ms. Mitchell regarding Department of Public Health social media. And continuing this pattern, demand for production number 7 requests communications between you and Hilda Solis regarding Department of Public Health social media. Have you corresponded with Ms. Solis via social or via email?
Yes, I have.
You have. Have you corresponded with her specifically with regard to Department of Public Health social media?
Not that I recall.
Okay, and I will ask that you conduct a search of your email inbox for correspondence between yourself and Ms. Solis regarding Department of Public Health social media pursuant to demand for production number 7. Demand for production number 8 on page 10 asks for documents reflecting communications between you and any other person regarding a Twitter account identified as alt_LACPH. Are you familiar with that account?
I am not.
Have you ever heard of it in your
I have
life?
not.
Okay. Demand for production number 9, any and all documents reflecting communications between you and Caitlin Barnes regarding Department of Public Health social media, including but not limited to emails, texts, or any other written correspondence. Are you familiar with Caitlin Barnes?
I am.
And how do you know Caitlin?
She's my daughter.
She's your daughter.
Asked and answered.
Does she live with you currently?
Not relevant to any subject in this lawsuit. You can answer.
Sometimes.
Have you communicated with Caitlin Barnes via email?
Yes, I have.
Have you communicated with her via email regarding Department of Public Health social media?
Not that I recall.
And I will ask that you conduct a search of your inbox for communications between yourself and Caitlin Barnes regarding Department of Public Health social media. I'm speaking a little fast. I'm sorry. I'm going to slow down. Okay, demand for production number 10, any and all documents reflecting Department of Public Health policies relating to communications with the public. Does the Department of Public Health have policies relating to communications with the public?
Yes.
Yes. Are those policies in writing?
Yes.
Have those been produced today?
I don't know.
Yes.
Great. And demand for production number 11 is any and all documents reflecting Department of Public Health policies relating to social media. Does the Department of Public Health have policies respecting social media?
Not that I know of
Okay.
or recall.
Number 12 is any and all documents reflecting Department of Public Health's determinations regarding who may be tagged in the county's social media posts. Are you familiar with any sort of policy regarding these determinations?
I am not.
Number 13 on page 14, any and all documents reflecting misinformation regarding public health guidance in comments on Department of Public Health social media posts. Are you familiar with any misinformation regarding public health guidance in the comments to the Department of Public Health social media posts?
I am not.
Not at all.
Asked and answered.
Number 14, any and all documents reflecting bullying in the comments on Department of Public Health social media posts. Are you familiar with any bullying in comments on Department of Public Health social media posts?
Could you restate that question? Because I'm not sure if you're asking me if I'm familiar, like if someone has told me that there's bullying that's going on, or if I have seen documents or have looked on the social media posts and seen people doing those activities.
Have you personally seen any bullying in the comments to the Department of Public Health social media posts?
I have not, but I do not review the social media posts.
You do not review the social media
I
posts?
do not review
Asked
the
and
social
answered.
media posts.
And I am
You just said
repeating,
that.
and I'm repeating the statements because with the mask, it is difficult to understand, and I want to make sure we have a clear record.
And let's ask the court reporter to see if the most important person in the room has heard it and put it in the record.
And I would also like to clarify for my own understanding as the deposing attorney. Thank you very much.
You're welcome. I'll continue to
Okay.
object on that ground.
Are you familiar with bullying in the comments? Meaning, has anyone told you that there's bullying in the comments on the Department of Public Health social media posts?
Yes, they have.
And who told you that?
I don't recall.
Do you think it was Brett Morrow?
I don't recall.
Who manages the Department of Public Health's Twitter account?
I think there have been a variety of people managing that account. Brett is the person in that office that I would talk to the most. But there are other people in the office that also work closely with communications that could have communicated that information to me.
And what kind of bullying was going on, according to the people you spoke to?
I don't really recall any details of how it was described.
Do you recall whether the bullying was targeted toward you or toward other members of the public?
My recollection of the conversation around bullying on the social media post was not about bullying directed at me.
So it was bullying of other individuals?
Yes.
Of members of the Board of Supervisors?
It was bullying about other members of the public.
Members of the public.
Yeah.
And number 15, any and all documents reflecting harassment in comments on Department of Public Health social media posts. Are you familiar with any harassment in the comments on the Department of Public Health social media posts?
I have seen no social media posts.
Has anyone told you that there was harassment in the comments?
To the best of my recollection, in the same conversation that we were discussing bullying, we were discussing harassing comments as well.
And what's the difference in your mind between bullying and harassing?
I think they're very similar.
Number 16, any and all documents reflecting threats in comments on Department of Public Health social media posts. Are you familiar with any threats in the comments on Department of Public Health social media?
I have not social media posts. Could you define social media for me? Like when you say social media, what are you including there?
I'm referring to Twitter, Facebook, Instagram.
I think the answer is yes.
So you're familiar with threats?
I have been shown threats.
Shown threats. Did you produce those documents today?
The only threats that I have been shown were threats against me that were then sent to the sheriff.
And those were in the comments to the department's social media?
I cannot be sure.
So it could have been via direct message?
I cannot be sure.
And I'll ask counsel, did you provide any documents reflecting those threats today?
I don't know. I gave you the archive. We produced the entire archive.
Do you know how many gigabytes were produced?
I do not.
Okay, we asked for the org chart. I assume that it's in these documents that I will review on our break. Number 18, on page 18, any and all documents reflecting the Department of Public Health's decision to disable public comments on its social media posts on or about August 4th, 2022. Were you involved in that decision?
The communications office made that decision and then informed me of it to see if I had any objections.
Did you have any objections?
I did not.
Did you have any concerns?
We discussed making sure that at the town halls, people would be able to ask us questions.
And how do those town halls work?
I can't talk about how the platform works. I can talk about how we organize the town hall. We have various presenters that talk for a couple of minutes each on the topic for that town hall. They're generally clinicians and public health practitioners. I usually am moderating, and then after those short presentations, we open for questions from the general public and try to get to as many of the questions as possible related to the topic that's being discussed.
And how are those questions moderated?
I would not know the answer to that.
Are you the person who gets to ask the questions of the panelists?
I'm given a list of questions that come, because I think there's a variety of ways that people can ask us questions. And so I will be given a list of those questions as they're coming in, and then I will go ahead and ask as many of those questions as I can.
But you don't always ask all of the questions.
We never have time to ask all of the questions.
Are you aware of whether or not all members of the public participating in the town hall can see the questions being asked?
I have no idea how the technology works.
And do you select the clinicians and the public health practitioners who speak on these panels?
I will do that with my team. You know, we really are responding often to questions that are being asked of us. So if there's a new guidance on vaccinations, for example, we'll do a town hall on vaccinations. And then we'll have our experts on vaccinations present the information.
Would you ever invite a clinician or a public health practitioner who has views that are divergent from yours on best practices with respect to COVID?
As far as I recall, all of the presenters at our town halls are people who work at the Department of Public Health.
Okay. Is this clear for your transcript?
Yeah, only because I'm hooked up to his audio. Otherwise, I wouldn't be able to do it.
Number 19, any and all documents reflecting an archive of Department of Public Health's data from Twitter showing the @LA Public Health accounts activity from March 1, 2020 through the present. And my understanding is that a full archive of the data has been provided on this thumb drive, which I will review on the break. Are you aware that the Department of Public Health's Twitter posts prior to September of 2022 are no longer visible on Twitter?
I'm not sure what you meant. Could you say that again?
So each Twitter user has a timeline, and the Department of Public Health has a timeline. And in the timeline, it shows a series of posts in chronological order. The Department of Public Health's Twitter stops in September of 2022, and there are no posts that are viewable on the timeline prior to September of 2022.
I'm not sure I understand at all what you mean. So I don't know how to answer.
So I'll just take that as a no. You're not aware.
I'm totally not aware.
Thank you. And you said you're not aware of any misinformation in the comments to the Department of Public Health's social media posts.
You already asked, witness already answered.
I have not seen any of the posts. I am aware that there was a lot of misinformation that other people were contributing on our sites that was creating a lot of confusion. But I didn't see those posts, and the conversations I had was that they were happening and they were problematic, and there was a lot of them.
And do you recall what kind of misinformation was being shared?
I don't recall the details. I think a lot of it was around vaccines and masks, but I have no details and poor recollection.
And you were concerned about that misinformation, is that correct?
I am concerned about misinformation, yes.
Why?
We're the public health department. People coming to our sites are looking for accurate information. And as the public health department, we take that responsibility very seriously.
And how do you determine whether a piece of information is misinformation or not?
We have a team of epidemiologists, clinicians, public health practitioners who work hard to determine what is accurate information. So I would say when the information is not aligned with what we've determined is accurate information, for us that would represent misinformation. You asked a hard question because there are lots of different ways people can think about misinformation.
And so if I'm understanding correctly, information that's not aligned with what the Department of Public Health has put out would constitute misinformation.
Objection. The witness provided her testimony.
I don't think that's what I said. It's not necessarily information that we've put out. It's information that we have determined is credible and accurate and based in science. Sometimes there could be misinformation circulating about a topic we have yet to present information on.
And so how do you determine whether something is credible and accurate and based in science?
There's a review by a team of qualified people at the health department that look at the information, that are versed in public health practice and research, and the appropriateness of research, and the epidemiology of disease, that actually are working together to make those determinations. There's no one person that does that job.
Can you name anyone on that team?
Yes.
Will you please?
Dr. Sharon Balter.
Anyone else?
Dr. Paul Simon.
Not the musician.
Not the musician.
Anyone else?
Dr. Dawn Terashita.
Anyone else?
It's a long list.
About how long?
Dr. Muntu Davis.
Anybody else?
I'm trying to make sure I have everyone's last names. I would have to give you some first names because I'm not sure. I think Dr. Prabhu Gunder, but I'm not positive about the last name. Dr. Zach Rubin. Dr. Rita Singhal. There's, I'll stop there.
Okay, thank you very much. So tell me if my understanding is correct. If conflicting pieces of information regarding an issue came to the department, would this team that you just described meet and discuss and decide which is more credible?
Improper and incomplete hypothetical. Calls for speculation.
Different people on our teams have different areas of expertise. Depending on someone's area of expertise, they would be called to review documents. They would also be looking, obviously, at documents that were coming out of CDC, the Centers for Disease Control.
Out of CDC? And if the CDC took a position on an issue, would your department align with the CDC on that issue?
Not always.
Not always. How has your department differed from CDC guidance with respect to COVID?
So how does this have anything to do with the subject of the lawsuit, which is social media or free speech?
It goes to the petitioner and plaintiff's theory of the case, where we have a theory of why social media comments were blocked and how the public was restricted from communicating with one another.
Why don't you
and-
ask those questions then?
I mean, are you planning to stop the deposition? I don't think I'm under any obligation to explain the full legal theory.
If you continue in things that are outside the subject matter of the current lawsuit, which is the free speech claim, I will just instruct the witness not to answer, but I won't stop the deposition.
That's going to be a problem. We are not asking questions that are outside the scope, and I would caution you not to instruct your client not to answer on relevance grounds, but that's your risk to take. You seem like a risk taker. Okay, so let's move on.
That's inappropriate and it's unprofessional. I ask you to please cease that.
To what?
I will ask you to please cease that.
Please cease what?
I said that was improper and unprofessional, your comment.
Is it improper and unprofessional to keep my client locked downstairs in the lobby?
We had an agreement where she could come up. You reneged on it.
I'm sorry. I'm under no obligation to give you anything in order to have my client in the room. But we're going to move on with our deposition. Number 21, any and all documents reflecting Department of Public Health's objective in disabling comments on its social media posts. What was the Department of Public Health's objective in disabling public comments on the social media?
The Department of Public Health closed public comments to ensure that on our sites, people were receiving accurate information.
And I would express to your attorney that determining what constitutes accurate information and how that process works is going to go to the respondent and defendant's objective in disabling comments, which is relevant to the free speech claim. Demand for production number 22, any and all documents reflecting Department of Public Health's consideration of alternatives to disabling comments on its social media posts. Did the department consider any alternatives to completely closing off comments on the department's social media?
That would have been a conversation that would have happened in the communications office.
So with Brett?
Well, with Brett and his team.
And you were not involved in that conversation?
I was not involved in that conversation.
Demand for production number 23, any and all documents reflecting alternative avenues for communication between members of the public following the disabling of comments on the county's social media posts. So this question and this demand seeks to understand what, if anything, the department did to ensure that the public could continue to communicate with each other regarding Department of Public Health issues.
I think from the department's perspective, we are not creating platforms for individuals to communicate with each other. We want to make sure people can communicate with us, ask us questions, offer their advice or their comments or their counsel, and that we can be responsive to those queries and hear their advice.
Would you agree that prior to the decision to shut off the public comments, there was a platform where the public could communicate with each other regarding Department of Public Health issues?
I wouldn't know that.
You wouldn't know.
I wouldn't know.
Asked and answered.
All right, and I'll just ask one more time for you to return to your email inbox and to conduct a search of all responsive documents that we discussed in this exhibit. How are you doing? Do you need a break or?
I'm good.
Okay. How are you doing? So I understand you have a PhD in social welfare. Is that correct?
No, it is not.
Do you have a PhD?
I do.
And what is that in?
I'm not sure what I don't think it just says social welfare. I'm not actually sure what it might say on a diploma. My PhD was I was awarded that PhD. I was part of a Pew Fellowship that actually was doing work on health policy.
And where did you receive that PhD?
Brandeis University.
Brandeis.
The fellowship program was a joint program between BU and Brandeis. Boston University, sorry.
How long did you attend that program?
I don't recall. Coursework was 2 years, and then there was work to complete a dissertation.
Do you have any other degrees?
I do.
What are those?
I have a Bachelor's of Arts from University of California, Santa Cruz. I have a Master's in Public Health from Boston University. And I have a Master's in Education from the University of Massachusetts.
It's a lot of degrees. So how did you become the Director of Public Health for Los Angeles County? Did you respond to a job listing?
Compound question. Questions.
I was recruited. I was recruited for the position.
Were you recruited by the Board of Supervisors?
I was recruited by a recruiter.
And who did you interview with?
I interviewed with Dr. Mitch Katz, and then I interviewed with the Board of Supervisors.
Did you have personal relationships with anyone at the county or on the Board of Supervisors prior to your interview?
I did not.
I'd like to take a break so I can pull up the documents produced.
We're going record at 12:44 p.m. We're back on record at 1:19 p.m. Please continue.
Thank you. And I will restate once again that my client has been sitting in the lobby downstairs since 11:30, and it's now almost 1:30. And I will ask one more time that Mr. Raygor allow my client upstairs.
We had an agreement earlier where I said that if... Well, let's go off the record.
I'm not doing this. Yes or no? I'm not going off the record. Yes or no?
You don't want to meet and confer about it and repeat our agreement that we had earlier where I gave
I'm
you...
not...
Just a minute. I'm still speaking. I gave you an offer to allow her to come up at the beginning of the deposition. You accepted the term and said, yes, I agree. I went to just write you a simple email to confirm that. Mr. Burney, who came back in here, told me you had reneged. So it was you who did not allow her to come up here.
Number one, I am under no obligation to do anything in order to have my client, a party to this case, attend this deposition. Under no obligation whatsoever. There's no legal authority for that. Number two, I never agreed to put anything into writing or to sign anything that you draft up for me to sign while I'm taking a deposition. I would never do that.
I wasn't
so I'm
asking
going to
you
give
to
you,
sign.
excuse me, I'm speaking. I'm going to give you one last opportunity, and then we are going to seek sanctions against you. Okay? Under CCP 2025.420B12, any party, deponent, or other affected person or organization may move for a protective order to exclude designated persons other than the parties to the action and their officers and counsel from the deposition. You have no authority to keep her out. So one last time, are you going to allow Ms. Berwick to come upstairs?
Are you going to... Your word for her being a member is not sufficient. It's not evidence. Are you going to... We should be able to state on the record that she is a member.
Yes.
And at some point when we have our meet and confer, will you
I'm not agreeing to anything. She's coming up or not?
Okay, well, now you're reneging on that agreement. Proceed. We just had an agreement, I thought, but now you're reneging on that.
She will come up and say on the record that she is a member. I'm not agreeing to anything else. I'm not obligated to do that. We are going to seek sanctions against you unless you let her up right now. It's your call. Do you need time to confer?
I don't need it, but I'd like it.
Okay. Go ahead.
Go off the record.
Not with me. I'm done talking to you about this.
No, it's your deposition, Julie. I can't tell you to go off the record so I can go out and talk with my client. You can do that.
So you would like to go off the record so you can go talk to your client
Yes.
about allowing my client to attend the deposition?
I can't confirm that because you're asking me to disclose attorney-client privilege communications or work product.
Okay. If you need to go off the record in order to make this call, please feel free, but please return within 2 minutes so we can continue and stop wasting time. Thank you.
You could have stopped wasting time by meeting.
Mr. Reguar, you are being abusive at this point.
You could have stopped.
You are being abusive at this
You
point.
could have stopped wasting time by meeting.
You are being abusive at this point. I am asking you.
Please let me finish my statement. If you're not going to give me common courtesy or professionalism, okay. I don't have to take this. Are we off the record now?
No, we're still on the record.
You said we could go off the record. Will you please let us go off the record?
Sure, we'll go off the record.
We're going to the record at 1:23 p.m. We're back on record at 1:34 p.m. Please continue.
Thank you very much. Will you allow my client to come upstairs now?
I will, but I got to have a security officer approve it. I was waiting for him to come up. I don't know where he is. But yes.
Okay. Thank you.
As long as she states on the record that she's a member, that's
fine. How do we expedite the security process so Ms. Berwick can enter the building?
I'm trying to find somebody else. They're supposed to interrupt
Okay.
me if they can find somebody else, because the guy, Quincy, is in a meeting somewhere.
I assume that the receptionist is able to call down to security and allow someone to enter.
Yeah, but based on her tweeting stream this morning, while she's been in the lobby, the security officer got concerned.
I have not seen it. Okay.
So I've got to get him to sort of intercede. Let's go off. Can we go off so I can go talk to reception?
Sure.
Off the record at 1:35 p.m. We're back on record at 1:38 p.m. Please continue.
Thank you. I am marking as Exhibit 3 the County of Los Angeles Department of Public Health organization chart that was produced by respondents and defendants this morning. Thank you. I believe Mr. Reguar has your org chart.
This one was mine.
Have you seen this document before?
I have.
And is this your current organization chart for the Department of Public Health?
It is.
And at the top here it says Director of Public Health, Health Officer, and Chief Deputy Director. Are those three different people?
Yes, they are.
And you are the Director of Public Health?
Yes, I am.
And are you above the Health Officer and Chief Deputy Director in the org chart?
Yes, I am.
Okay. And where does Brett Morrow fall on this org chart?
Brett is the Office of Communications and Public Affairs Director. So he's right under us.
And does Brett take direction from you?
At the moment, Brett is a direct report to the Chief Deputy Director. But I obviously work closely with the Chief Deputy Director.
Who is the Chief Deputy Director?
Megan McClare.
Megan McClare?
McClare.
How do you spell that?
Megan is M-E-G-A-N. McClare is M-C-C-L-A-I-R-E.
Is she a physician?
She is not.
Do you know, does she hold any advanced degrees?
She has a master's in public health.
A master's in public health.
And she might have other degrees as well.
Okay, so Brett Morrow reports to Megan McClare, and Megan McClare reports to you.
Yes.
Do you ever have meetings directly with Brett Morrow?
I don't know that I would call them structured meetings, but I do meet with him
How often?
on an as-needed basis.
And when do you find that you need him the most?
One of my roles at the department is I approve all content for communications. So anytime we're doing a campaign or we're creating educational materials, at some point the content is reviewed by me.
And do you review all of the posts on social media?
I do not.
You do not. And so when you say content, you mean longer form documents.
Yeah, if we're focused on vaccinations, then I will get some written documents saying, here's our suggested messaging on vaccinations for the next 3 weeks. And then there's a team of folks, once I look at it and I say, yeah, this sounds great, then there's a team of folks that will turn that into, a variety of actual messages.
And
So I don't necessarily see every message, but I see the content that will build towards those messages.
Okay, but you don't necessarily approve every single
No.
post that's made on social media?
No, I don't.
Does Brett?
You'd have to ask Brett.
Do we know if...
Was this Exhibit 3, by the way?
Yes. Do we know if Ms. Berwick is authorized yet?
I have been overruled, unfortunately, so it's out of my hands.
You've been overruled?
Yes, based on her conduct in the lobby, as reported by security, and on her Twitter stuff that's going on now. Security is determined not a good liability risk.
Can you explain exactly what you're talking about so
No,
that I
I
have
can't.
that for the record?
No, I can't.
So you're excluding my client, but you're not explaining to me why.
I just explained it's out of my hands.
Well, I need to understand what the reasons are because we are seeking sanctions against you.
Okay, got it. I understand.
Can you provide me with whatever it is you're talking about?
Not during the deposition. Let's finish with Dr. Ferrer.
Okay, I'm texting her to tell her to leave now, and me doing that means I'm bringing a sanctions motion against you. Okay? Outside of public meetings, how do you communicate with the Board of Supervisors?
There are emails, there's phone calls that you might have. We attend a lot of events, and there may be Board of Supervisors that are at the events or sponsoring the events. In terms of formal communications, we go through the board and the board office. There's an executive office of the board.
So you communicate through the executive office to get to the board.
Or we send an email to all of the members of the board, or we communicate with their staff.
And for the record, Ms. Berwick is disputing what you just told me, and so I'm assuming you're going to provide me with evidence that you are justifying your exclusion of my client on Mr. Raygor. Do you have personal relationships with any of the members of the Board of Supervisors?
How would you define a personal relationship?
Do you discuss non-work issues with any of the members of the Board of Supervisors?
I'm sure there's casual conversations. How's your family? Did you see a movie? But I don't have personal friendships with any of them.
Do you keep in touch with Sheila Kuehl?
I have. You mean keep in touch with her when?
Since she left the Board of Supervisors.
Yes, on occasion I have had a meal with her.
So you've told me a little bit.
Only since she's not been, I want to go on record as only since she's not been a supervisor.
Okay, thank you.
When she was a supervisor, I didn't have any meals with her.
Okay. And you told me a little bit about this earlier, but I want to make sure I understand your job and your duties as the director of the Department of Public Health. Can you describe those to me?
Can you be more specific about duties? Just overall responsibility, or are you looking in particular for supervision responsibility? I mean, it's super broad.
It is broad.
Yeah.
What are your goals and objectives as the director? What's the overarching on a macro level?
The overarching objective is to ensure that residents in LA County have resources and opportunities to be in optimal health and well-being.
And how do you define optimal health and well-being?
I'm not sure there's a definition.
Do you consider mental health to be part of that?
Yeah, we consider physical and emotional well-being.
Does the Board of Supervisors evaluate you on an annual basis?
Yes, they do.
And what benchmarks are you supposed to meet?
Every department head is part of an evaluation process where we lay out and have agreed upon goals and metrics for every performance evaluation period. And then all 5 supervisors evaluate us based on the goals and objectives that got laid out. Those will incorporate overall county goals as well.
And do you have were there any specific goals or metrics that you were aiming to meet in this past year?
There's a whole list of goals and metrics for this past year.
Are any of those goals or metrics COVID numbers?
No. Like COVID numbers?
Can you
What
give
does
me an
that
example of one of the goals or one of the metrics?
mean? I can't recall the exact language, so I'm hesitant to answer the question.
I'm just curious about how the Board of Supervisors measures your performance. Is there anything tangible or measurable that you can think of?
We have a measure in there to ensure that residents have access to vaccines and therapeutics. And then we will measure that throughout the year around how we've set up a vaccine network and how we're distributing therapeutics. That is not necessarily the specific metric, but that is an example that I think gets to what those metrics look like.
Okay, so there would be a certain goal in number of vaccines administered, for example?
Not necessarily in number of vaccines administered, more if the issue is access to vaccines, it would more be access points to vaccines.
So would that be like the mobile vaccine campaign?
Yes, we would include information about the 700 plus sites we offer every week for mobile vaccines. We'd include information on the distribution of where people can get vaccines so that wherever you are in the county, you have access to a place to get vaccinated. We'd include information about how homebound residents can get somebody to come to their house to vaccinate them.
And as the Director of Public Health, you are essentially the decision maker for LA County Department of Public Health, correct?
I am the director and make the final decisions. Or have delegated authority to other people on my team to make the final decisions.
Are you responsible for the public health orders that are issued by your office?
I am not.
You're not. Who is responsible for those?
Dr. Davis is the health officer, so he ultimately has authority over health officer orders, and he's independent authority over health officer orders.
Are you involved in the drafting process for those public health orders?
Depends on the particular health officer order.
Were you involved in the K through 12 public health orders?
Objection. We're getting very far afield from the free speech claim that's at issue here, involving the closing of public commentary on Twitter, Instagram, and Facebook. Are we going to come back to that soon?
As I described earlier, these are relevant questions. You may answer.
We'll let you go a little bit further, but if we're not going to get back to that, I'll have to instruct her not answer.
Most likely. There were numerous orders, and so I'm not trying to be evasive. There was not just one order.
And is your involvement more providing policy direction or coming up with specifics?
There's a school team that will really usually come up with specifics and work with Dr. Davis on those specifics. But I'm likely to understand any directions that are being given in terms of actions or changes that are going to happen at schools. I work very closely with school administrators, less closely with the drafting of a health officer order.
And what experience do you have leading a response to an infectious disease epidemic?
Objection. Let's move on. That's
Credibility of the witness.
I'm sorry, that's not. No. I'm instructing the witness not to answer. It is not within the scope of the sole remaining claim at issue in this case, which is a free speech claim directed at the closing of public commentary. The witness is very busy, available for a limited period of time, and is ready, willing, and able to talk about issues relevant to the only subject matter relating in the lawsuit. What you're asking now is not a subject matter of the lawsuit.
And I will just say for the record that California Evidence Code Section 210 defines relevant evidence as evidence including evidence relevant to the credibility of a witness or hearsay declarant having any tendency and reason to prove or disprove any disputed fact that is of consequence to the determination of the action.
Okay, I'll be right back. I left my notes in the other office.
And security has denied that they are refusing to allow her up. They said it's Shepard Mullen. We're still on, correct?
Yes.
Can you restate my last question?
One moment.
Oh, I have it.
Okay.
So I'll ask it again. What experience do you have leading a response to an infectious disease epidemic?
So that is not within the scope of discovery. CCP section 2017.010 defines the scope of relevant discovery as evidence that is relevant to the subject matter or itself admissible or reasonably calculated to lead to the discovery of admissible evidence. This question and others that might be forthcoming similar to it are not focused on the subject matter of the lawsuit, which is now just a single claim for free speech violation arising from the closing down of public commentary on Twitter, Facebook, and Instagram. Citing to the the California Evidence Code on credibility in such issues does not give anyone a free rein in any deposition to ask any question they wish. It's got to be circumscribed, and it is circumscribed by the subject matter of the lawsuit.
And I will say that information shared by members of the public on LA County Public Health Twitter threads, which Department of Public Health cut off, is quite relevant to this case. This case is about freedom of speech on a very critical issue that led to extreme harm to children, especially in LA County. These questions are all relevant to demonstrating how and why decisions were made to eliminate public discourse, control the narrative, prolong harmful, restrictive measures without any means for the public to share critical information about the realities of the virus. So, if you are through harassing me, I would like to continue. These questions are relevant to petitioner's theory of the case, which the petitioner is under no obligation to provide to defendant, respondent, and my client is still downstairs. So, are we ready to move on?
A couple of things. First, you're not a petitioner anymore, you're a plaintiff. Second, the statement that you just read, if you want to ask her questions about whether any of those were reasons for closing off public commentary, you certainly have free rein to do that.
We already have testimony on the record that misinformation was one of the reasons. So we're going to move on with questioning. I'd like to not be interrupted anymore. What experience do you have leading a response to an infectious disease epidemic?
So that goes to credibility, as you stated, so I'll instruct her not to answer. As beyond the scope of discovery as stated in CCP 2017. As I recall. Yes.
I'm going to need a rough. Okay, and this is not just credibility, but this also goes to the fact that we have records showing many experts in the field disputing the conclusions of the Department of Public Health and sharing that information on public comments on social media, and then we have the Department of Public Health closing off those comments. This is all quite relevant to the action, and I'm going to continue to ask these questions, and if you continue to instruct not to answer, I will have no other option but to move to compel and seek sanctions against you.
Did not close off those comments, cut off or closed all comments.
Excuse me?
It was not.
Are you testifying?
No, I'm stating something.
Okay.
The closing of public commentary was agnostic. It was not focused on any particular person or line of inquiry or line of commentary.
I'm going to ask the attorney for the witness to stop making speaking objections and to stop testifying. Barbara Ferrer is here to testify, not Kent Raygor.
Yes, and I was not. I was responding to your statement, Julie. That's only the reason. If you want
I'm
to
gonna
stop
ask the
making,
question
if you
once
want
again.
to stop making speeches, then I won't have to respond.
You are forcing me to do so by instructing your client not to answer relevant questions. This is not going well.
For you, I agree.
What experience do you have leading a response to an infectious disease epidemic?
I believe that's the same question. And I had instructed, if it is the same question, I had instructed you not to answer.
What experience do you have in leading responses to outbreaks of infectious diseases?
Same instruction.
What specific training have you had in infectious diseases?
Same instruction.
Have you reviewed any studies of infectious disease epidemiology?
Same instruction.
Do you have any specific degrees in those fields?
Can you read back the question?
One moment. Do you have any specific degrees in those fields?
Vague and ambiguous.
Do you understand the question?
Can you clarify what fields?
Do you have any degrees in infectious disease epidemiology?
I have a master's in public health.
And how does that relate to epidemiology?
Everybody who has a degree in master's of public health has taken numerous courses, both in infectious diseases and in epidemiology.
And are you familiar with the concept of reproduction number?
I am.
Can you explain what that is?
I don't know enough about what it is to be able to object.
It talks about how quickly, what the sequencing is of replication of, in this case, a virus.
So what role did Dr. Muntu Davis play in the county public health response to COVID?
Dr. Davis and I are co-incident commanders of the response, and Dr. Davis has his independent health officer authority that actually allows him to determine when and if to issue health officer orders.
And why was he not more front and center as the face of public health during this COVID response in LA County?
Lacks foundation, assumes facts not in evidence, argumentative.
I think he was very visible, so I'm having a hard time answering because from my perspective he was very visible. Everyone had lots of different roles that they were playing, and there's certainly some sectors where he was the primary contact person.
And did you consult any infectious disease experts from the community or from local universities?
That's a
Objection. Extremely broad, not limited to any time frame, not limited to anything relevant at all to the suit.
Do you understand my question?
I do, and of course we consult with infectious disease experts for many diseases. I mean, we deal with a host of infectious diseases, so I'm not sure exactly what you're asking me to answer here, but the answer is yes.
Were there any local universities in particular that you developed good relationships with their infectious disease experts?
In the last 6 years?
Yeah.
Our team has strong relationships with all of the larger universities and with the larger healthcare systems and their infectious disease teams. So we have infectious disease physicians that actually cultivate, nurture, and maintain those relationships.
And we spoke earlier a little bit about Brett Morrow. How did you first meet Brett Morrow?
I cannot recall.
Did you create a job post for his role?
As far as I can recall, absolutely not.
No.
I don't really create the job posts, so
Did you hire him?
yes,
Is he an employee of LA County Department of Public Health?
yes.
Is there a budget for Brett?
There's not a budget for Brett. There's a budget for the communications office.
Do you know what that is?
I do not.
And I believe you mentioned that Brett reports to Megan McClare, who is the Chief Deputy Director, correct?
Yes,
And you give direction to the Chief Deputy Director, who in turn gives direction to Brett. Is that correct?
I don't think I would characterize it that way.
How would you characterize it?
I speak with the Chief Deputy Director. She shares information with me. I share information with her. Some of that information she uses to guide her conversations with Brett Morrow.
Did you ever ask Brett or anyone else to brief you on what people are saying on social media regarding your policies?
I don't recall.
And if Brett did or said something on social media with the LA County Department of Public Health account that you didn't agree with, would you discuss that with him?
Improper, hypothetical, incomplete.
Could you repeat that?
Sure. If Brett did something that you didn't agree with using the Department of Public Health social media accounts, would you discuss it with him?
If that's a hypothetical question, I would either discuss it with him, but I would probably more likely discuss it with the Chief Deputy.
Have you ever attended a Board of Supervisors meeting in person?
Yes.
Are they in person now?
Yes.
How long were they remote only?
I would not be able to answer that.
It was about 2 years, correct? If you had to give me your best estimate.
I don't really know. It was a long time.
Do you remember the last time you attended a remote-only Board of Supervisors meeting?
I do not recall.
Did you ever hear about people having difficulty getting through to speak when the hearings were remote?
The Board of Supervisor
Yes.
hearings? I don't recall.
Did you personally ever experience technical difficulties when participating in a remote Board of Supervisors meeting?
I think once there was a problem getting connected.
And what was the process your office used to respond to direct messages on social media after disabling public comments?
Can you repeat the question?
Sure. What was the process your office used to respond to direct messages on social media after disabling public comments?
I don't know.
That's a Brett question.
That's a Brett question. I'm not sure what direct messaging is.
Have you ever facilitated any physical group meetings or town halls for the public to discuss public health policy?
Ever?
In your time at LA County?
Yes,
When?
on numerous occasions.
Did you ever do it with COVID?
Objection, vague and ambiguous. You mean while she had COVID?
During the pandemic, from March 2020 through the present?
In person,
Yes.
I'm sure we did, but I can't recall the actual instances. I mean, we were not remote for a while, and then we were remote for a while, and then we were not remote again for a while, so.
Because it seems like lately all of the town halls are remote. Is that correct?
I think the town halls are, the town halls that we've been doing since the pandemic have all been remote. I think there are other smaller community meetings that are not remote. And some of those get called town halls as well, so I think that's the confusion here.
And are members of the public invited to your weekly press briefings?
That's a Brett question. I don't have the answer.
Are members of the press invited to your telephonic K through 12 briefings?
They are not.
Why not?
The decision on the sector-specific telebriefings was to create them as a space where people, where we could have a dialogue about concerns that were being raised, and not for anybody on those calls to feel like they would be quoted. So that, people would feel they had a good opportunity to think out loud, say what was on their mind, use the information they gathered to maybe make a different decision later on, without being quoted on the media, by the media.
And what kind of people are invited to the K-12 press briefings?
They're not press briefings, so
K-12 briefings.
the list for the K to 12, there are two meetings we have, so that's why I'm confused. There's a meeting that the LA County Office of Education sets up with, and you'd have to get from them the invite list, but I believe it's superintendents from all of the school districts. And that's also an opportunity for us to get questions and give out information. And then there's what I think you're talking about, the telebriefings on the phone, and I don't know exactly who's invited. It's sent out by another unit, does all the invites, but I think it's a very extensive list of folks who get invited, and then those are not closed calls. I mean, we ask that the media, hang up, and we let people know that it's all off the record, but anybody who gets information about those telebriefings, and there's a massive distribution about the telebriefings that we're having, is welcome to dial in.
And I'm looking at my other questions, and these all seem to be Brett questions, so I'm going to skip over these. Do you know if LA County USC Hospital was ever tagged in any of your Department of Public Health posts?
I can't answer that because I don't know what being tagged means.
So does your department have, and I think you answered this earlier, your department has policies and processes it uses to communicate with the public, correct?
It does.
And I believe you produced a document that's responsive, correct?
I don't know.
And unfortunately, I only have this in electronic form because I was not provided with printed copies of documents. This is the County of Los Angeles Public Health contacts with news media. It's a 2-page document. And I guess we're not going to be able to mark it as an exhibit.
I offered earlier if you wanted those printed out, I could have that done.
Yes, please.
You just said that you wanted the org chart, that's why I printed that one out.
Yeah, I asked you to print out all the documents in an email, but
I haven't seen that yet.
perhaps you could have those printed and also let my client up. Would you be able to handle that?
I can print out the documents. Do you want to take a break so I can do that?
No, I don't want to take a break.
Okay.
I'm sure that there are assistants here that can handle that.
There are, but I would have to talk to them, so.
That's what email was created for. Okay, so I'm just going to go through this document unless you want to have the documents printed. You also have
like I said,
another, you have co-counsel here.
I
I'm
s-
here by myself. My client is still in the lobby. It's now 2:15.
I said I would get you the documents.
I don't want to take any more breaks.
Okay.
So use your resources. We are in Shepard Mullen's offices. There are 1 million people in here. I suggest you use your resources.
I've got another thumb drive in my office over there. I can't magically go get it and have somebody come and find it. I have to actually walk over there, give it to someone, and tell them what to print out.
Okay. Can you
And
do
I'm
that?
happy to do that.
Can you do that in 1 minute?
Probably.
I don't want to keep taking breaks.
Probably.
Go for it. Thank you.
We are going on the record at 2:17 p.m. We're back on record at 2:23 p.m. Please continue.
Do you have printed copies of the contact with news media policy?
Yeah, just hold on a second. Okay, I'm missing the first few. I think it's in there. Is there a 401? I think 408 was the,
400-R1. Are you talking about a Bates number?
yeah, is it 401 to 407?
407.
407.
406 to 407.
Do you need anything?
I'm good. Thanks.
We're still on the record.
To go.
I'll wait for. Thank you. I'm going to I'll have you mark as Exhibit 4. Is that where we are?
That is.
Bates stamp 406 to 407, County of Los Angeles Public Health Contacts with News Media Policy.
Julie, if you just hand me those, I'll have somebody make 2 copies of everything. So.
Thank you.
Oh, thank you.
Are you still on?
Yes, we are.
And I will note for the record that this deposition continues to be delayed and time wasted. And I will read a tweet from my client, Sarah Beth Berwick, from today at 2:23 that says, apparently, Shepard Mullen attorney Kent Raygor is now claiming security will not allow me up because of my tweets and conduct in the lobby. This is obviously a lie. The security guy just came over and told me Shepard Mullen is still denying me access to the office. I've been sitting here calmly for 2.5 hours. I've approached security a couple of times to politely ask if they heard from Shepard Mullen yet, and once to ask for the nearest restroom. I've taken down the names of the security staff who have observed me waiting for nearly 3 hours. I informed them that Mr. Raygor claims that security will not allow me up. All 3 security staff on duty say that's not true. Moving on to the deposition. Are you familiar with this document that we have marked as Exhibit 4?
Yes, I am.
And is this the current policy for contacts with news media?
I believe it's true. Yes.
Has this policy changed at all within the last 2 to 3 years?
I don't think so.
So essentially what I gather from this policy is that any media requests have to be vetted through a public information office.
Officer.
Officer.
I think a PIO's, I think an officer.
And those PIOs work under Brett?
Yes, they do.
Okay, thank you. And to your knowledge, if I'm recalling your earlier testimony correctly, the department does not have any written policies regarding social media.
As far as I know.
Okay. At any point in the last 3 years, has any member of the Board of Supervisors expressed concern about lack of access to your office by the public?
I really can't recall.
Have any of the members of the Board of Supervisors expressed concern about the inability to comment on social media posts by the department?
I don't believe that anybody has expressed that concern to me. I can't really speak for other expressions of concern to other people.
So Catherine Barger's office, for example, has not contacted you with concerns about accessibility?
Not that I recall.
Would she contact you normally, or would she contact Brett for something like that?
In general, the supervisors don't contact us directly on most issues where they're asking questions. They have someone from their office contact us, and that would probably not go directly to me. That would go to our board liaison office, and then they would try to funnel the request to the appropriate staff person, and that's how it would get answered.
Okay. So are you aware of anyone from the staff of any of the Board of Supervisors expressing concerns about the lack of accessibility to the Department of Public Health?
I cannot recall being aware of that.
And you personally did not ever see comments on Department of Public Health social media prior to them being disabled?
I did not.
Are you familiar with the public comments that were submitted to the Board of Supervisors on September 27th, 2022, most of which were asking the board to reopen public comments on Department of Public Health social media?
What was the question?
Are you familiar with the public comments submitted to the Board of Supervisors on September 27th, 2022, most of which were asking the board to reopen comments on Department of Public? You're not familiar?
No.
Do you believe that your department has an obligation or responsibility to prevent bullying?
Again, that's a difficult question. We have a legal obligation to prevent bullying in the workplace, as does everybody in the workplace. So the answer is affirmative for our obligation in the workplace. I'm not sure that we have an obligation, I mean a legal obligation in other settings, but we certainly do our very best to promote a climate of respect and tolerance and an anti-bullying culture.
I'm going to hand over what I will have marked as Exhibit 5, thank you, which is a tweet from Marla Tellez, Tellez, saying her chief communications director sent us a statement, and she's referring to you. Do you have it in front of you?
I don't.
Okay, I'll wait until you have it.
Let me see, it's one of those for me. Yeah.
Are you familiar with this statement?
So just objection, lacks foundation, that Ms. Tellez was referring to Dr. Ferrer.
Are you familiar with this statement?
I'm familiar with it now.
Had you not seen it before?
I wouldn't recall.
So this is, according to this tweet on August 4th, 2022, this was the County of Los Angeles Department of Public Health's official statement on why comments were disabled, and it says, public health has zero tolerance for threats, bullying, or harassment on any of our platforms and made the decision to disable social media comments after receiving concerns from numerous residents who were targeted.
objection lacks foundation, lacks authentication, and violates the best evidence rule. There's no indication this is a tweet.
Yeah, I'm confused about, I mean, I'm having a hard time answering because this doesn't look like a statement from us right now. So was there a statement? I mean, you showed me something that somebody tweeted, and you're asking me if I saw this. I mean, I might have seen a statement, but I definitely didn't see this tweet. So I'm not sure what you're asking me. The answer is negative on the tweet. I didn't see this tweet.
But you've seen the statement.
Well, I would have to see the statement because I'm assuming the statement wasn't just this sort of phrase.
And I'm trying to pull up the documents. It would be helpful if Mr. Regor could identify the document number which was produced this morning.
If you want to hand them back to me,
It was like you're saying it was like a
sorry.
media statement? Is it a media statement? Like, I don't know what
Yes.
this is from. Okay.
Did you say that they're out there?
I asked somebody to bring in copies. They didn't yet.
Please don't leave again. I don't want to waste any more time.
Somebody trying to, do I need to answer something right now?
I'm
I
just
don't know where
pulling.
we are.
Do you want to go
Okay.
up to the desk and see if they have those copies?
Okay. The document is identified as Bates number 409 to 410. And it's an email. Once the copies come in, I will have them marked as Exhibit 6. And it's an email from Brett Morrow to Elizabeth Ford, DPH Media, and Marla Tellez. Am I pronouncing that correctly? Tellez?
Well, do you think she's Latina? If she's Latina, it would be yes. But I don't know how people pronounce it. I mean, where I'm from, double L is like a Y almost. But I don't know. I mean, I can't speak for her. I'm not really sure how she pronounces it.
Maybe I'll just call her Marla so I don't butcher her name. Thank you, sir. We're looking at Bates 409 to 410. Thank you.
Here's another set.
Please mark this as Exhibit 6.
Oh, thank you.
So this thread begins at the bottom of what's marked as 409. From Elizabeth Ford, it says, "Hi, LA County Public Health Media Team. Fox 11 viewers wondering why the comments have been turned off on the LA County Public Health social media accounts. Can you please provide a statement on this?" And then we have a response from Brett Morrow, and he says, "See below from Public Health. Public Health has a zero tolerance for threats, bullying, or harassment on any of our platforms and made the decision to disable social media comments after receiving concerns from numerous residents who were being targeted. Residents who wish to share their thoughts with Public Health on social media can still do so by sending direct messages to our accounts." Do you recognize the statement now?
I don't recall. I'll be honest. It was a long time ago. I can say that for the most part, my approval is needed on press releases, but not on all communications with media outlets. So, and I just don't recall seeing this. That doesn't mean that I didn't, but I really don't recall.
So you don't recall whether or not you approved this?
Yeah, I think it's unlikely that I approved it, and because there's not an approval process for communicating with the media, except the approval process that's in place around press releases.
And you don't recall any conversations with Mr. Morrow about this particular statement?
Not about this particular statement. I don't.
Does this reflect accurately what your position is?
Vague as to your, you mean the department's or Dr. Ferrer's?
What was there?
You may answer if you understand.
Oh, okay. I don't disagree with this statement. I think in the conversation that I had, I think my emphasis was on misinformation and not having our sites be used to spread misinformation. But I do agree that I don't want our sites to be used as places where people are threatened either. I don't think this fully captures my sense of how that decision was made and characterized. But I do agree that our sites can't be used as places where people are feeling threatened and bullied.
Is there any other reason you can think of that would have led the department to close off public comments on social media?
No, I think, our record speaks for itself in many ways about our real desire to make sure that people can get good information from us, ask questions. I spend a lot of time in the field. I go door knocking. I mean, I think, we make every effort that's possible to be able to have information that people can get from us that we think, obviously, this is our interpretation, that we think is accurate, and to answer people's questions. I also think it was a reasonable decision to make sure that when people came to our sites looking for that information, it was pretty easy to just get that information and not have other, different, as you noted, contradictory information on our site. But I can't think of any other reason that we would have done this.
What would be the risk of the public having access to information that deviates from the Department of Public Health guidance?
I think the public has tons of access to that. I think it's sort of what's the purpose of our site is really what's probably important to us. The purpose of our site is so that people have information that we want to communicate. If we were the only site where you could get information, that would probably we'd be in a different country, and that would be a different story. In this country, people have access to all kinds of information from all over the place, depending on what means of communications they're comfortable using. We have TV, we have lots of people can search the web. I don't think anybody lacks the ability to get information on differing views than ours, but I think it's appropriate for our site to represent the information we think is credible that the public should have.
And did you ever work with local media outlets to review content regarding COVID that they intended to air to make sure that it aligned with the guidance from the department?
I never did. But you'd have to ask our communication team whether there were any requests from local media for us to play that role. I wouldn't know that.
So you're not familiar with any role that the department played in curating COVID-related content at local media outlets?
I'm not familiar with that, and I would imagine that if that happened, it would be at the request of a local media outlet.
So the local media outlet would probably contact Brett to get his approval on something that
They
they're gonna
might
air.
say, you know, we're wondering, you know, the only way I see this happening is somebody calls us and says, I looked through your materials, you know, we want to put a piece of this, but we're changing it a little. Here's what we're going to go with. Is this accurate? But I don't think we approach the media and say, you know, we want to review what you're posting. I would find that highly unlikely, and certainly nothing I know about.
Okay. And so if I'm understanding your testimony correctly, you do believe that the Department of Public Health has an obligation to prevent the spread of misinformation. Is that right?
Objection. Her testimony speaks for itself, whatever she just stated.
I'm not sure that's exactly accurate, and I think it's the word obligation that I'm going to be a little bit fussy about, because I don't know if you mean a legal obligation, or, you know, I don't know what kind of obligation. I think we have to do our best to make sure that people have accurate information, and we generally spend almost all of our time trying to promote accurate information. I don't think we spend a lot of our time trying to address all of the misinformation that's out there. So I think we really come at this from our obligation is to provide people with accurate information.
I'm going to ask that we mark as Exhibit 7. Is that where we are? The Morbidity and Mortality Weekly Report, COVID-19 case rates in transitional kindergarten through grade 12 schools and in the community. Los Angeles County, California, September 2020 through March 2021.
Did you mean to pass this?
No. Thank you.
So it's just these two.
Yes.
Thank you.
Here, let me see, are there 2 copies?
Have you seen this study before?
Just a minute, let's look through it.
It's not a study, this is an article. So yes, I've seen this article before.
It's an article,
Yeah.
not a study. What's the difference?
Well, the article is reporting on some data that they looked at. A study would be probably much longer, much more detailed. It would contain a lot of other information that you might not get in the article.
Okay. Did you ever rely on this article in issuing any health orders?
No, and I don't issue health orders.
Dr. Muntu Davis. Are you aware of whether the CDC relied on this study to issue any orders?
Objection. We're far afield from the reasons or rationale for closing public commentary on Facebook, Twitter, and Instagram, which is the sole remaining claim in this action. So unless you can show how this relates to that, I'm going to instruct her not to answer.
And again, this goes to credibility of the witness, and it goes to the plaintiff's theory of the case as to why social media comments were shut down and the timing.
If you want, again, if you want to ask questions about, did this have any role to play in shutting down those commentaries, you are welcome to ask that, but these questions that you just asked, or the question you just asked is not directed at that.
Are you familiar with the authors of this article?
I'm familiar with all but one.
Which one are you not familiar with?
Sherry Yin.
Sherry Yin. And Caitlin Barnes, identified here, is your daughter, correct?
Yes, she is.
And at the bottom of the second page, the very end, it says, all authors have completed and submitted the International Committee of Medical Journal Editors form for disclosure of potential conflicts of interest. No potential conflicts of interest were disclosed. Are you familiar with that?
I'm familiar with what's written here, yes.
And no conflicts of interest were disclosed with this article.
Instruct the witness not to answer for the reasons stated previously.
On relevance? You're instructing on relevance?
On scope of discovery,
Relevance?
CCP 2017.010. It's no longer the subject of this action. Unless you can ask a question whether this had any role to play in the closing of public commentary on the social media accounts.
Did this report have any role to play in the closing of comments on social media posts?
No.
Are you aware that people were referring to this study and the conflict of interest in the comment section of the Department of Public Health's Twitter account?
Lacks foundation.
I mean,
Calls
the
for
answer is no.
I'm going to have marked as Exhibit 8 a Twitter thread from July 20th, 2020. July 20th, 2022. Sorry.
I think you passed the same document. Oh, is that, there's so, oh, okay.
It's just one page.
I have 3 pages. Is it all the same?
The one with my writing on it is for me.
Okay.
Thank you.
There you go.
Have you seen this before?
No, I have not.
So this is a Twitter thread that starts with a tweet from the Department of Public Health on July 20th, 2022 that provides the COVID-19 daily update. And there are a series of responses in the comments below. The first is a quote tweet of Bill Malugin from Fox LA, saying a study cited by the CDC that found COVID mitigation efforts like mask mandates in schools were effective was authored by LA County bureaucrats, including the daughter of Barbara Ferrer. The conflict of interest was never disclosed. Jen Van Laar reports. And then below that, there are a couple of more photos and references to a purported conflict of interest and nepotism. But this had nothing to do with the department's decision to turn off public comments.
Absolutely not. I mean, first of all, I never saw it. Second of all, as you're well aware, there were lots of other places where people were bringing up the same issue and complaining. And the conflict of interest, there can be no conflict of interest between two parties that are working on either a study or an article together. A conflict of interest in our world is a third party that's interfering. So there's no third party here. A lot of the information in this study is from people who work for me at the Department of Public Health. So it's just, I mean, I think we answered this question over and over again. We understand that some people look at this and see it differently, but there really is no conflict of interest when two organizations are partnering together in terms of those disclosures. That's not what's expected on the disclosures. And as you are well aware, people for 3 years have posted everywhere on their own accounts, on other people's accounts, their disagreements or their worries about me or some actions I've taken, and that there'd be no reason to close this down for that. I mean, and I've never seen this until you're just showing it to me, and it's never come up in any of the discussions.
So you've never heard about the comments regarding potential conflicts of interest?
Not that were posted on social media.
Where did you hear about it?
Well, I think television, I think Fox in particular, did a lot of TV and asked direct questions about this. So I was well aware and have indicated that. I'm well aware that there were issues being raised, but I'm not aware and have never seen the posts that you just showed me that showed up on our social media. And I didn't really know about this. And I think in some ways, it doesn't change anything. I mean, there were lots of other places where people were expressing their concerns, and I was very aware of them, but not that it was showing up on our sites.
Can you provide an example of the other places that people were able to express their concerns?
I mean, people have their own Twitter accounts and their own Facebook accounts, and I don't, the way lots of people are communicating with each other is not a way I communicate with people, so I can't speak really on the depth of how people are communicating with each other and exactly which social media platforms they're using. But I do know that there are lots of places where people are able to post negative remarks or disagreements or dislikes, about me personally or about other people or about positions that we're taking. And all you would have to do is probably do a search on Twitter to find all those other accounts. So they're not my accounts, and they're not our department's accounts, but I do think there's plenty of places where people have felt like they have a lot of opportunities to go ahead and let each other know and let others know how they feel. I think there are some formal routes. The Board of Supervisors has public comment. People email me with their comments. People email the director's box with their comments. People call my office with their comments. So I think there's tons and tons of ways that people can express themselves and have expressed themselves. And none of those got closed down because people were being negative or saying things. You can still call the office, you can still send emails. So it seems like it would be a far stretch to equate any closing of public comments on the sites we use to give out information with this campaign. And I also don't know the time sequence because this would be a blur to me. Like, sort of, when did this happen? When did things close down? When did people in my office start talking about closing things down? I think that would be something you could get more information from Brett about.
Okay.
I keeping this?
Yeah. Why don't you keep that there in the pile for,
Okay.
keep that in the pile for the court reporter?
Do you have a personal relationship with anyone at the CDC?
Yes, I do.
And who is that?
Well, I have a professional relationship. So the answer is no, I have no personal relationships. The CDC is huge. There probably are a couple of people, I'm not sure they still work at CDC, but have worked at CDC that I've had personal relationships with.
Do you have a relationship with Rochelle Walensky?
I have a professional relationship with her, yes.
How frequently do you speak?
I would say infrequently.
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 Maybe once a month, if you had to estimate?
I don't even think we speak that often.
Were there any periods of time where you were speaking with her more frequently?
She made a site visit to LA, and we probably spoke more frequently right before she came, and then in sort of the couple of weeks after she was here, just sort of following up on some of the places she had visited and questions she had. I don't think there's any other period that stands out where we had frequent conversation.
Do you recall when the site visit took place?
2020. I want to say spring of 2022, but I'm not positive, so I don't recall.
Have you considered reopening public comments on social media?
We have not.
And why not?
The decision is based on the fact that we want to use our sites to convey the information we want to communicate with the public. And that remains true today.
So when I say Soothiness Wednesdays,
When you say what?
Soothiness Wednesdays, does that mean anything to you?
No.
No. Okay.
Does it mean anything to you?
Soothiness? Like
Soothiness?
S-O-O-T-H-I?
It's probably not a real word.
Okay.
It's a phrase used. Soothiness Wednesdays.
Never heard of it.
Have you ever watched the weekly town hall videos that the CMO, CEO, and chief epidemiologist at LA County USC put out for their staff?
I have not.
Can you repeat the question, please?
I'm sorry. I need to drink calm tea. Have you seen the weekly videos that the CMO, CEO, and chief epidemiologist at LA County USC put out for their staff?
If I could just add, CMO, Chief Medical Officer?
I have not.
No, never.
Never.
Have you heard about those videos?
I've heard about a couple of those videos.
What did you hear about them?
There's a video where a couple of people from USC, LA County, LAC, were talking about the fact that the epidemic was over, and that there was really no need for people to be worried. It was a staff meeting, I think. But I think there's I don't know if we're talking, I don't know if this is the same thing. There was a staff meeting that was held where there was communication about the sense from the team there that the pandemic was over.
And did that concern you?
Yes, it did.
Why?
At the time, the pandemic clearly wasn't over, and I always worry about one hospital's experience in a large county like ours with over 10 million people, and that hospital in particular does maybe about 3% of the volume of hospitalizations, making an assessment about a pandemic ending without additional information.
Did you review the video of the town hall staff meeting?
I did not.
You just heard about it?
I just heard about it.
Who told you about it?
I cannot recall.
Are we on 8?
9.
9. Passing over to mark as Exhibit 9, another tweet thread that starts with an LA County Department of Public Health tweet dated July 27th, 2022. And this provides another COVID-19 daily update. I'll give you time to look at it before I ask questions.
Thank you.
I think one's for me.
Okay.
And I'll assume you haven't seen this before.
I haven't seen this.
Have you heard the phrase snowflake weepies?
I've heard it. I'm not sure what it means.
I just mentioned that because it's in the...
I know.
The
I have
second.
no idea what it really means, but I have heard it.
Well, in the second reply from Pavement 1999, it says, I encourage anyone who believes there is a COVID emergency in LA to watch today's LA County USC press conference. Read through this thread too. And then it quote tweets Phil Kirpin, who includes a video from LA County USC Medical Center. To your knowledge, did the sharing of this town hall video have any influence on the department's decision to disable public comments?
It did not.
So you weren't concerned about misinformation about the end of a pandemic being posted on the Department of Public Health's social media accounts?
I've already said that the reason for closing the social media accounts to public comment was so that there wouldn't be misinformation. So if this information was going to be posted along with other pieces of misinformation on our accounts, that would be in that broader category. But this one particular instance did not play into that decision. As far as I know, this got broad dissemination through other people's accounts. So again, it's not about a particular piece of misinformation that's showing up. It's about people coming to our site and having access to information that's not ours.
And so is it your opinion then that the information shared by the LA County USC doctors in that staff meeting saying that the pandemic was over, that's misinformation?
I would have said that's misinformation. Or yeah. I would never use that. I mean, I'm not going to quibble. I mean, that's not language I would have used. I don't think particularly... When did this happen? At that point in time, anybody would have said the pandemic's over, really. I mean, most people were not using those terms in public health. So, but certainly people are entitled to their opinions about when they think the pandemic ended or started. And, you know, there's no way of my controlling that kind of misinformation. The issue for us is on our site. We don't want to be magnifying that kind of information. I can't really do much about the differences of opinion that people hold outside of, outside and in other places, and I'm not even intending to be disrespectful to people who hold independent or different decisions. All I can say is We curate our information really carefully. As I described, we have a whole team of folks that look at information to determine its accuracy and determine what needs to be on our website. That's the intent here.
And what is your fear with respect to something like this town hall video reflecting that staff meeting? What is your specific fear about that being shared and disseminated widely?
I don't have a fear of it being disseminated widely because I can't control that, and there's no point in being fearful about lots of things you can't control. I think that you'd be scared of a lot then. I try to sort of narrow what I'm going to really worry about, and that's why I'm saying that those are not the reasons. There's no particular instance that you could point to that I would say like, oh, this is misinformation that we have to do something about immediately. In general, this kind of information that goes out and gets a lot of attention, I think doesn't help us encourage people to continue to protect each other when there's a need for people to protect each other. I think at last July, on average, there were 15 to 20 deaths a day of COVID, one of the highest mortality rates that we have when compared to other diseases. And, for us, we're very focused on trying to prevent as many people from being severely ill or dying from COVID. So, it's sort of a global issue and not particular to this. And I don't see it as my job to prevent this kind of misinformation from being circulated by other sources. I think we need to counter it, and we need to make sure that we're giving people what we think is an accurate assessment as a public health department.
And you mentioned a statistic about deaths per day, 15 to 20?
Yeah, I think, again, to the best of my recollection.
Would those be from or with COVID?
Deaths are classified as being COVID deaths by a very strict definition. And so they're deaths of people who either died of COVID or COVID contributed to their cause of death. And that determination is made in some cases by a medical examiner, in other cases by death certificates, record reviews.
And so
not a decision we make, I guess that's what I'm saying. Not a decision made by the Department of Public Health.
And so would your office review medical examiner records and death certificates to determine the death count?
I'm going to instruct you not to answer because now we, again, are outside the scope of the subject matter of the remaining claim in this lawsuit.
Okay. And I will state that there are other exhibits I intend to provide where people are commenting about the distinction between deaths from and with COVID, and the contention there is that public comments were shut off so that people weren't aware of such a distinction. So this is highly relevant, and I would like to continue this course of questioning.
Well, certainly you can ask those questions about whether people were aware of that, and you can ask whether or not that awareness or those pieces of information had anything to do with the decision to close off public commentary.
Were you aware that people were expressing concern that you were using deaths with COVID rather than from COVID and overstating the death count?
Yes.
And were you concerned about that?
No.
Why not?
The definition of how deaths are classified is an agreed upon definition that gets used to classify deaths, not just of COVID, but all kinds of diseases. Cancer, infant deaths, maternal deaths. I mean, there are definitions that get used for all deaths. And it's a fairly complex algorithm that is used, and then we use that to do the classifications. I can understand that some people might not really understand exactly how death classifications are done, But I wasn't worried that there was significant overcount or undercount of deaths. And the bigger conversation was actually always around hospitalizations, not deaths.
So on this Exhibit 9, in the COVID-19 update, it says there's 1,280 currently hospitalized. Do you know if that is broken up by from COVID or with COVID?
I don't know what you're referring to.
I'm looking at Exhibit 9.
Oh, this exhibit here?
Yes, and so
Okay.
the very top, the first tweet is from Department of Public
Yeah.
Health, and it has a COVID-19 daily update,
Yeah,
and it says 1,280 currently hospitalized.
yeah.
And that, is that,
That's the total number of people hospitalized, but we did start producing, and probably back around in 2022, differentiating between people hospitalized with COVID and people hospitalized for COVID. It sounds straightforward. It's not quite so straightforward. The people who are incidental are people who come to the hospital and they are classified as being positive for COVID because they got tested. They didn't necessarily come to the hospital to get care. And then there are people who came to the hospital because they're sick with COVID-related illness and they're getting care. Some people who test positive for COVID when they come in, 2 or 3 days later, while they're still in the hospital, may in fact develop COVID illness. So none of this is particularly, it's not perfect, but we have produced the differences between incidental COVID hospitalizations and hospitalizations for people with COVID disease, related disease. It's not on this, but we have it, and we've shared it a lot.
so Doctors Spellberg and Holtum of LA County USC are part of health services, is that correct?
They are.
Okay. And I think you told me earlier that with respect to an organization chart, you are equals with the Director of Health Services.
That's right.
Okay. And so Dr. Spellberg and Dr. Holtum do not report to you.
They do not.
They report to...
I don't know who they report to, so I'm not going to comment.
Okay.
I mean, I know who the director is of the Department of Health Services, but I don't know who they directly report to.
Who's the director again?
Dr. Christina Galley.
And I'm going to hand a 2-page document to mark as Exhibit 10.
Thank you. Still not the same. Oh, there we go. Okay.
I'll give you a moment to look it over. Just look up at me when you're finished and I'll start asking questions. Okay, thank you. So the first page is the original tweet, which is from the Department of Public Health. And it says LA County enters high COVID-19 community level and will require masking indoors if the county remains high for 2 consecutive weeks, effective July 29th. And the second page shows 2 responses. And the first response says, why do real doctors have a very different perspective? Public health, social justice warriors should be ignored. I prefer to listen to actual doctors. And then it includes a video of Paul Holtom at LA County USC. And then below that is another response that says, meanwhile on Earth. And it includes another video of Paul Holtom, Jorge Orozco, and Brad Spellberg of LA County USC saying only 10% of our COVID-positive admissions are admitted due to COVID. Virtually none of them go to the ICU. And when they do go to the ICU, it is not for pneumonia. They are not intubated. We have not seen one of those since February. Do you recall, I know that you haven't seen this because you don't go on Twitter, but do you recall your office issuing the statement on page 1 on July 15th that we were entering high community level?
Yeah, I don't recall, but I think it happened.
And do you remember hearing that the LA County USC doctors were saying only 10% of COVID positive admissions were admitted due to COVID?
No, I don't.
Is it concerning to you to see that as a comment on the department's social media?
I don't know what you're asking me. This is a comment on these are people posting on our account.
Yes.
I think this is part of what was happening with the account. But no, does this particularly concern me? It concerns me only in that the message we're trying to give out is this message. And now people are paying a lot of attention to this message. We're trying to tell people there's a lot more transmission. The truth of the matter is there was a lot more transmission. I mean, the way you measure transmission is an agreed upon measure, again, similar to deaths. And so when the community level went high, as defined by the CDC, it does mean that it is real, that more people can get infected. So this is the message I want people to get.
So
and what's upsetting is not the content of this message, but that it's different from this. And on our site, all I want people to see is this.
So the very first use of this message, the third use of this message, the fifth and the sixth use of this message, we're referring to the first page of Exhibit 10. Mm-hmm. And then the intervening uses of this message, we're referring to the second page of Exhibit 10.
Thank you. Sorry about that.
That's okay.
The video can help with that as well. Okay. I'm handing over a 2-page document that I'd like to have marked as Exhibit 11. And this is a statement on behalf of LA County's LA County and USC Medical Center on state of current COVID-19 hospitalizations from Health Services.
On this.
Have you seen this letter before?
I don't recall.
Objection, lacks foundation that it's a letter.
Statement. Have you seen this statement before?
Yeah, I don't recall. It's not our statement.
And this is from Health Services.
Yeah.
And Health Services is the entity for which Dr. Spellberg and Dr. Holtom work, correct?
Yes.
And this appears to have come out 2 days after, well, 3 days after the LA County Department of Public Health statement on the first page of Exhibit 10. Is that correct?
That's what it appears.
Do you recall Health Services issuing this statement?
I believe I do.
Did you have any involvement in getting this statement issued?
No, I did not.
Did you express concerns to Dr. Galley, or is it Gailey?
Galley.
Did you express any concerns to Dr. Galley about the LA County USC Town Hall video?
I may have. I really can't recall.
Do you think Brett Morrow would have contacted Health Services regarding this statement?
I don't know.
But you don't specifically recall reaching out to Dr. Galley to have them issue this statement?
No, but it's really I don't recall reaching out as opposed to, yeah, I just don't recall. I talk very frequently with Dr. Galley, so I can imagine that we had a conversation just about making sure that we were all messaging together, that the pandemic wasn't over.
Do you recall her being upset with Dr. Spalberg and Dr. Holtum?
I do not. And she would not have told me that anyway.
We're making progress.
Good.
I'm passing over a one-page document that I would like to have marked as Exhibit 12.
Thank you.
And I assume you haven't seen this before.
I haven't seen this.
Did you hear about Dr. Spalberg tweeting this statement on September 4th?
Well, I don't know if I heard about it. I mean, I'm reading it now. It's inaccurate.
How is it inaccurate?
If people test positive for COVID and then they die and they were in a car accident, they were in a homicide, they were a suicide, they had some, injury, they had some other compelling factor that caused them to die, they're not, even if they tested positive, they are not counted as a positive, by nobody. Nobody's counting those as positive, as COVID deaths. So it's just an inaccurate definition. I'm not sure where he got that definition, but he's also not the person either at his hospital that is really signing death certificates or entering in that information. So he might not have known what the definition was, but all of those people who die, even if they had tested positive for COVID, those are not counted as COVID deaths. That's what I was saying. There's an algorithm. Lots of things come out when you establish there's another cause of death.
Is there a place where one could review that algorithm? Where does that exist?
Objection. I'll instruct the witness not to answer. You're far outside the scope of the remaining subject matter of this action now. And for the same reason, this particular Exhibit 12 was it post-dates the closing of public commentary on social media.
Were you aware that this tweet was deleted?
Objection lacks foundation.
Which tweet?
I don't.
The Brad Spellberg tweet from September 4th.
Oh, no,
Did you have any involvement in the deletion of this tweet?
I did not.
Were you aware that Dr. Spellberg had agreed to an interview with a local Fox affiliate in September around the time of this tweet?
I was not. I mean, I don't, right, I was not.
And Dr. Spellberg wouldn't have to go through your comms
Absolutely
department.
not.
You would have to go through the communications
yeah.
department of Health
Health
Services.
services, yeah.
And they have an entirely separate.
Completely separate.
Okay. I accidentally marked someone else's copy as 13. Sorry. I'm going to ask to mark as Exhibit 13 a 2-page exhibit that is from the County of Los Angeles Department of Public Health's website, and it's called Communicable Disease Investigation and Response Protocol Revisions for Schools.
Thank you.
Oh, okay. Thanks.
Are you familiar with this document?
Is there a date on this?
Yeah, I'm looking for the same thing.
It was printed off of the Department of Public Health's website either yesterday or the day before. There's an effective date in the first paragraph of January 14th, 2019.
It was printed off as a,
I printed this.
but as an archive document. It's not the current protocol. That's what I'm trying to ask. Is this,
This is.
I don't know.
This was printed directly off of the department's website.
Right. On our website, we keep copies of everything we've ever issued, and then we have a current protocol. I would suspect this isn't the current protocol, but I'm not sure. But that's why I was asking you, was there a date on this document? Because if I can't really answer the question.
I'll direct your attention to the second
Okay.
page, and there's a row for influenza and other acute respiratory diseases,
Yep.
and there are outbreak and exclusion criteria.
Yep.
And I'm curious as to why this guidance was not followed for COVID.
Objection lacks foundation, lacks authentication. Incomplete, hypothetical.
Is COVID considered a respiratory disease?
Yes, it is. It is the most deadly respiratory virus we have circulating.
And is there a reason why your department deviated from the influenza and respiratory disease outbreak?
I'll instruct the witness not to answer because this has nothing to do with the current subject matter of the lawsuit unless you can tie this to some reason for why public commentary was closed on social media accounts.
Were you aware that people were commenting about the deviation from the outbreak and exclusion criteria that the department had in place for COVID?
No, I was not.
And again, I disagree with counsel's instruction not to answer on relevance grounds, as these go to credibility and to the the plaintiff's theory of the case.
What time are we at? I did.
3:30.
We're at 3:30?
Yeah, a little past.
Okay. Do we know how much longer? I mean, also about a break. I probably need to. Do you know about how much longer? Just so I could decide whether we should take a bathroom break or not.
I'm going to guess I can wrap this up in 30 minutes.
Oh, fine.
If there's
We'll
no
just-
further.
yeah. We'll just go then.
Okay. I'm handing over a multi-page document that I'll have marked as Exhibit 14. And this is a document from the California Department of Public Health entitled COVID-19 Age, Race, and Ethnicity Data, dated April 7th, 2023.
Could you give that date one more time?
April 7th, 2023.
Thank you.
Thank you.
Are you familiar with these
Just-
reports from CDPH?
Just a second, is that where this is from? It doesn't show what it was printed from.
It's from CDPH. The printing was not wonderful. I'm not asking you to authenticate this document.
okay.
Just wondering if you're
I
familiar.
know that they produce these tables.
Are these, in your opinion, are the CDPH tables and data reliable? Are they something that you use in your work?
Objection. Outside the scope of the subject matter of this lawsuit, unless you can tie this to some rationale or basis for closing public commentary on the department's Twitter and other social media accounts.
And I will.
I'm going to foreclose. I'll instruct her not to answer. I'll give you a few questions to see if you can tie it up.
And I will again disagree with counsel's instruction not to answer on relevance grounds. There are credibility issues at play, and what this document shows is that there are about 98 total deaths from COVID or associated with COVID in California for kids under 18 for the entire duration of the pandemic. And the information shared from the official Department of Public Health account made things sound quite different and quite scary. And it's part of the theory of the case that public comments were shut off to avoid having information like this shared.
But this is 8 months after it was cut off. The commentary was closed.
Yes, this data has held relatively steady for the entire pandemic. So I'd like to question the witness now.
Okay. Do you have data from August of 2022? The same kind of CDVH data?
Well, I can ask Dr. Ferrer. Have you been monitoring these CDPH reports?
I don't personally monitor these reports. We have our own reports with the same data for LA County. So I would be much more interested in monitoring LA County, but I am aware of these reports.
Do the County of Los Angeles numbers deviate much from these numbers?
I think a quarter of the deaths in children are from LA County residents.
So a quarter of these deaths listed here.
Yeah, I mean, I would have to look at the dates, but
So would it be fair to say that there's significant age stratification in COVID risk?
yes, and if you look on our website, we publish the data on children's deaths and have for the entire pandemic. So there's no effort made to not share this data. This data actually gets updated every week on our website. Or it was updated every week. We're not doing it quite as frequently now, but just.
Are you aware of any harms of masking children?
Objection. That's part of your lawsuit that was dismissed with prejudice. Your claims, 1, 2, and 4, as I recall. And so it's outside the scope of discovery of the subject matter of the action as it presently stands, and I'll instruct the witness not to answer.
And again, I disagree with counsel's instruction not to answer on relevance grounds. It's totally inappropriate. This goes to credibility, and it also goes to the constant recommendation and mandate issued on Department of Public Health social media that children wear masks to be safe without ever acknowledging the harms. And those harms were constantly acknowledged in public comments below the Department of Public Health's official posts.
So if you can tie that to any decision to close off public commentary on social media accounts for that reason, to not share that data, then pursue that. But
And again,
otherwise, no.
I'm not required to do that, but I will endeavor to do so. These are totally improper instructions not to answer. So we will have a voluminous motion to compel and sanctions motion. Were you aware that people in the public were expressing concerns over harms to children that were forced to mask?
For the duration of the pandemic or at any particular time?
At any particular point.
Oh, yes, of course.
Did you ever consider those harms?
Consider the harms or consider what people were noting as harms?
Either one.
Yes.
Did those go into how you crafted the COVID policies and COVID mandates?
Just as a reminder, health officer orders are issued by a health officer and not by me. But our conversations around masking obviously weighed risks and benefits.
Is there any place that the public could go to see a weighing of harms versus benefits?
I think they could look at the information we were sharing, and yes, they could see that. I don't know that we called it risks and benefits, but we spelled out, particularly before vaccines, therapeutics, and testing was widely available, we were left with non-medical interventions to mitigate a pandemic, a deadly pandemic. So I think it was a question of people getting seriously ill, people getting infected. Maybe they don't get seriously ill, but they clearly can pass it on to others who will get seriously ill. So I think there was a lot of weighing, and I think the public had access to all that information.
Have you reviewed this petition for writ of mandate / complaint?
I don't know.
Have you read it?
I don't know what
The
document
lawsuit
you're
that was
talking about.
filed.
No, I have not.
If you want to take a quick break, I'm just going to go through the documents that were produced this morning and see if there are any questions that I have,
Okay.
and then we'll wrap it up.
Okay.
We're good records at 3:48 p.m. We're back on record at 4:00 p.m. Please continue.
Okay. Thank you very much for being here today. I'm sorry to do this to you, but I'm going to have to suspend the remainder of the deposition in order to have you conduct a search for all documents requested in the demand for production. We are going to seek to compel testimony on questions where counsel instructed not to answer, and we will be seeking sanctions for wrongful exclusion of my client. So I would like to order a rough draft of the transcript here, and we will have to take care of that and then reschedule you to come back. But other than that, I have no further questions for you at this time.
Are these going back to you? Okay.
This concludes the deposition for today. We're going on the record at 4:01 p.m.